It has been a challenging one, to say the least, because we in my specialty of ear, nose and throat ENT are exposed in close proximity to the airway of patients' nose, throat areas. So it has been tough because we know we are in the danger zone. We have worn PPE appropriately. We have had to enhance our PPE to protect our colleagues and ourselves, but it has been difficult wearing them and doing our routine work.
The number of COVID-19 cases emerging daily across the UK is staggering. How well equipped would you say that you and your colleagues are in the fight against the virus this winter compared to back at the height of the pandemic?
Compared to the height of the pandemic, we are better prepared in some ways because we know what we need to do to protect ourselves, to protect our patients. We have better drugs. However, as you rightly say, the winter is a different climate and time altogether. The NHS is at its worst in terms of the number of patients in hospital already with winter bugs, flu, viruses, etc. So it has been tough to add on to that the challenge from treating coronavirus patients.
Dr. Kumar, I remember speaking with you back in the spring, and we discussed what had emerged as a possible symptom of COVID, the loss of smell and taste. Tell us more about how that became added to the official list of symptoms.
So we in the UK were the first to recognize this from reports around the world, but we highlighted this in March, as you say. It took a while for some countries to accept. Others were very quick. Our own Public Health England took about 6 weeks to accept after the World Health Organization in early May that this was an official symptom. Only in middle of May or thereabouts, 8 weeks after we proposed that this was a problem, was recognized by Public Health England. So it was frustrating.
And what else have we learned of this disease? Which of the things that we don't yet understand about the virus are of most concern to the medical community?
The virus is an interesting one. I use the word neurotropic virus. What it means is the nerves, especially in the head, in the nose, where the virus first invades the person, attacks the nerves of the sense of smell and other nerves in the head, including occasionally the hearing, the nerve to hearing, and sometimes disturbs the transmission of messages in the brain, we think. And that's why there's a distortion of the sense of smell. We call it a hallucination, an olfactory hallucination. And this causes psychiatric disturbances, sleep disturbances, nightmares in patients.
And some really important news today from AstraZeneca about the Oxford vaccine. How optimistic are you about the rollout of vaccines?
Oxford vaccine is a game changer. The Pfizer one, which was released and approved a few weeks ago, was good, but the Oxford vaccine is even better in some ways because it promises that the whole world, where the supply chain, where we do not have minus 80-degree freezers to transfer these vaccines in those cold storage conditions. So the Oxford vaccine does not require that. It's a game changer. Number two, it is also going to be very much cheaper. There are many millions of doses the United Kingdom has already purchased, but also other countries in the developing world have been promised access by many philanthropic organizations. The Oxford vaccine is going to be sold at cost price by AstraZeneca, and that's really something to be commended.